1. Numbness or weakness on one side of the body. A crucial yet overlooked sign. Have you ever woken up with a numb arm or leg, assuming it was just due to sleeping in the wrong position? Or perhaps you felt a slight numbness on one side of your face and dismissed it as a normal sign of aging. If you've experienced these symptoms, be cautious. They may not just be due to fatigue or posture issues, but an early warning sign of a potential stroke. Numbness or weakness on one side of the body is one of the most important indicators of a stroke, occurring when blood flow to the brain is disrupted. When the brain does not receive enough oxygen and nutrients, the nerves controlling movement can be affected, leading to numbness or loss of control in the face, arm, or leg on one side. This is a characteristic symptom, yet it is often overlooked or mistaken for other causes. Many people believe that temporary numbness results from poor sleeping posture, which compresses the nerves, or that it is a natural part of aging. However, if this condition occurs without a clear cause, lasts for several minutes to hours, or happens multiple times a day, you should not ignore it. Especially if numbness is accompanied by muscle weakness, difficulty moving, or loss of balance. It could be a sign of a transient ischemic attack, TIA. A crucial warning that a stroke may happen soon. So when should you be concerned? If you suddenly feel one side of your body becoming weak, even for a short time, you should seek medical attention immediately. Do not wait for the symptoms to disappear, as this could indicate brain damage. If you or someone around you experiences this, follow the FAST rule right away. F. Face check if one side of the face is drooping. A. Arms raise both arms. If one arm drops quickly, there may be an issue. S. Speech check for slurred speech. T. Time if any of these signs appear, call emergency services immediately. Recognizing early symptoms like numbness or weakness can help prevent a severe stroke. Listen to your body and never ignore even the smallest warning signs. 2. Blurred vision or loss of vision in one eye. A dangerous warning sign often overlooked. Have you ever suddenly experienced blurry vision, or even temporary vision loss in one eye without any apparent reason? This phenomenon may last for a few seconds, minutes, or longer, sometimes accompanied by flashes of light or sudden darkness. Many people dismiss it, thinking it's just due to stress, overworking, or a sign of aging. However, if this condition occurs suddenly and without explanation, it could be a serious indication of disrupted blood flow to the part of the brain responsible for vision, an early warning sign of a stroke. The eyes and the brain are closely connected through the optic nerve system. When blood flow to the brain's visual processing area is reduced or blocked, it can cause temporary vision problems. In many cases, patients describe feeling as if a foggy layer is covering their eyes, or they suddenly see flashing lights, distorted objects, or blurred images. Some even experience a black curtain effect, where part of their vision is suddenly blocked and then gradually returns to normal. Because these symptoms can disappear quickly, many people underestimate them, assuming they are just due to eye strain or aging. However, this could be a sign of a transient ischemic attack, TIA, indicating an increased risk of a real stroke in the near future. If left unnoticed and untreated, the chances of permanent brain damage rise significantly. What should you do? Do not wait for your vision to return to normal. If you suddenly experience blurry vision or temporary vision loss in one eye, especially if accompanied by dizziness, headaches, or muscle weakness, seek medical attention immediately. You should also use the FAST rule to check for other stroke symptoms. F. Face look for facial drooping. A. Arms check if one arm is weaker when lifted. S. Speech notice any slurred or unclear speech. T. Time if any symptoms are present, call emergency services right away. Do not ignore small changes in your vision. Listening to your body and acting promptly can help prevent serious consequences in the future. 3. Dizziness and loss of balance. A harmless symptom or a stroke warning. Have you ever felt sudden dizziness, lightheadedness, or loss of balance without any clear reason? Whether standing up, sitting down, or simply walking, you may suddenly feel like the ground is shifting, your head is spinning, or you are close to falling. Many people brush off these symptoms, thinking they are due to low blood pressure, lack of sleep, or general fatigue. However, If this occurs frequently or appears suddenly without an obvious cause, it could be a warning sign of reduced blood flow to the brain, a serious stroke risk factor that should not be ignored. The body's vestibular system helps maintain balance and coordinate movements. When the brain does not receive enough blood due to blockages or disruptions in circulation, you may experience dizziness, disorientation, or an inability to keep balance. In some cases, people may feel as if they are staggering like a drunk person, unable to control their movements, or experience blurred vision and nausea. Although dizziness can stem from various causes such as dehydration, anemia, or low blood sugar, if it is accompanied by other symptoms like muscle weakness, slurred speech, blurred vision, or severe headaches, you need to be extra cautious. This could indicate a transient ischemic attack, TIA, a warning that a stroke might happen soon. What should you do when you feel dizzy or lose balance? Do not try to move. If you feel dizzy while walking, stop immediately, sit down, or find support to prevent falling. Monitor your symptoms. If dizziness comes with weakness, facial drooping, slurred speech, or blurred vision, call emergency services right away. Check your blood pressure. If dizziness occurs frequently, monitor your blood pressure to see if it is related to hypotension. Seek medical advice. If the condition happens repeatedly or without a clear cause, consult a doctor for further evaluation. Do not dismiss occasional dizziness as something harmless. It could be an early warning sign of severe brain conditions, including stroke. Recognizing the symptoms early and taking timely action can protect your health and prevent devastating consequences. 4. Difficulty speaking or slurred speech, a strong warning sign of stroke. Have you ever suddenly found yourself unable to speak clearly, with slurred or garbled speech beyond your control? Or have you witnessed someone around you struggling to express their thoughts even though they are fully conscious? This is not just an accidental speech issue. It could be an urgent warning sign of a stroke that requires immediate attention. Sudden speech difficulties can manifest in several ways. Some people struggle to pronounce words correctly, their voice sounds distorted, their tongue feels stiff, or they lose control over their speech rhythm. Others may find it hard to recall the right words, leading to fragmented or incoherent speech. In severe cases, a person may temporarily lose the ability to communicate entirely, despite being aware of their surroundings. This condition occurs when blood flow to the brain's speech centers is disrupted, preventing the brain from processing and transmitting information normally. It is a critical warning sign of stroke and should never be ignored. Many people mistake this symptom for stress, fatigue, or aging-related changes. However, if speech difficulty or slurring occurs suddenly without an obvious reason, especially if accompanied by weakness on one side of the body, blurred vision, or dizziness, immediate action is necessary. What should you do? If someone experiences sudden speech difficulties, perform the FAST test to check for stroke signs. F. Face. Look for facial asymmetry or drooping. A. Arms. Ask them to raise both arms. If one arm drops, there's a problem. S. Speech. Have them say a simple sentence. If their speech is slurred or unclear, take it seriously. T. Time. Call emergency services immediately if any of these signs are present. A stroke can strike suddenly, but early recognition and timely intervention can significantly reduce the risk of severe brain damage or even save a life. Always pay attention to unusual changes in speech and act fast when needed. 5. Numbness or weakness on one side of the body, a red flag for stroke. Have you ever suddenly felt numbness, weakness, or even paralysis in your arm, leg, or face, especially on one side of the body? This is one of the most critical warning signs of a stroke and should never be ignored. This symptom occurs when blood flow to a part of the brain is blocked, preventing it from sending signals to the affected body parts. Depending on which area of the brain is impacted, you may experience numbness or tingling in the arm, leg, or face, often on one side, weakness or difficulty moving one side of the body, a loss of grip strength making it hard to hold objects, or a drooping face, causing an uneven smile or difficulty closing one eye. One of the biggest mistakes people make is assuming this symptom will go away on its own. Some think it's just due to sleeping in the wrong position, muscle fatigue, or a pinched nerve. However, If the numbness or weakness appears suddenly and without explanation, it could be a sign of a transient ischemic attack, TIA, or an impending stroke. What should you do? Perform the FAST test. O face, ask the person to smile. Does one side droop? O arms, ask them to raise both arms. Does one drift downward? O speech, ask them to repeat a sentence. Is it slurred or unclear? O time, if any signs are present, call emergency services immediately. Do not wait to see if symptoms improve. Every second counts when it comes to preventing a full-blown stroke. Avoid self-diagnosis. Seek emergency medical care right away. Even if symptoms disappear within minutes, they may return with greater severity if left untreated. Immediate medical attention can make a significant difference in preventing permanent brain damage. 6. Severe headache with no known cause, a silent stroke warning. Everyone experiences headaches now and then, but have you ever felt an unbearably intense headache that came on suddenly and without explanation? Some describe it as the worst headache of their life, with extreme pressure or stabbing pain that spreads rapidly. This type of headache could be a life-threatening warning sign of a stroke. Unlike common headaches caused by stress or migraines, a stroke-related headache often appears suddenly and intensely, feels different from usual headaches, is accompanied by dizziness, nausea, vomiting, or confusion, occurs with vision problems or difficulty speaking. This kind of headache is especially concerning if it's due to a hemorrhagic stroke, where a weakened blood vessel in the brain bursts, causing bleeding. If untreated, it can lead to severe brain damage or even death. What should you do? Do not ignore severe headaches, especially if they are sudden and extreme. Seek medical attention immediately if your headache is accompanied by O vision disturbances, O nausea or vomiting, O sudden weakness or numbness, O confusion or difficulty speaking. Monitor any new or unusual headache patterns, especially if you have risk factors like high blood pressure, diabetes, or a history of stroke. A severe headache could be your body's way of warning you about a serious underlying issue. Acting quickly can save your life or prevent long-term complications. Final thoughts. Recognizing stroke symptoms can save lives. Strokes often happen suddenly and without warning, but the body gives subtle clues before a major attack. The key is to recognize these signs early and take immediate action. Remember the FAST rule for stroke. White heavy checkmark face drooping. Is one side of the face uneven? White heavy checkmark arm weakness. Is one arm drifting downward? White heavy checkmark speech difficulty. Is speech slurred or strange? White heavy checkmark time to call emergency services. Act fast. Never underestimate temporary symptoms, such as brief vision loss, dizziness, or numbness. These could be warning signs of a mini-stroke, TIA, which greatly increases the risk of a major stroke in the near future. If you or someone you know experiences these symptoms, seek emergency medical attention immediately. Early treatment can make all the difference between recovery and permanent disability. Stay informed, stay alert, and protect yourself and your loved ones from stroke. Your awareness could save a life.